Hello everyone, my name is Raj Mukhia. I am a student nurse at the Erie Community College in Buffalo. Today I'm going to present you all a short video clip about seizure. And today I'm going to talk about the pathophysiology, how does the seizure occurs, the nursing management, how that has been managed by the nurse, and also about the community resources about the seizures. Please welcome to my video. So we're talking about seizure. Seizure is a neurological disorder impacted millions of people throughout the globes. It is characterized by the recurrent seizure, which is also called epilepsy. And also we have a lot of causes to the seizures that happens. So what is seizures? We have to understand this fact. It is a neurological disorder, and this seizure can happen at any age, from the baby until the old age. When we talk about the pathophysiology or the causes for the seizures, we have these four things in mind. The very first thing is about the genetic. And when we talk about the genetic, it is because of the gene mutation and the gene called SCN1A that can cause a difference and that can cause a seizure at the time of the birth of a baby. And the next cause or the next pathology for the seizure is the structural. When we talk about the structural, the first and foremost thing is the congenital during the embryo development inside the womb of the mother that has a defect in the neural system can cause seizure after the birth. And also we also have the other cause, which is also called the acquired one, which is a traumatic brain injury caused from the accident or any kind of injury to the brain, or the caused by stroke or the tumors. Those are the acquired one after they grow up. The next cause we can talk about is about the neurochemical imbalance. And then when we talk about the neural imbalance or the neurochemical imbalance, it is called the gamma aminobutyric acid, which is also called GABA. And this can have a role of exciting the brain. And defect on this acid or this GABA can also cause a seizure in human being. So now, the last cause about the seizure is the network dynamic. And when we talk about the network dynamic, what we can know is the seizures involve complex interaction across various parts of the brain, which alters both the local and the global connectivity pattern. For this perspective, pathology of seizures is manifold, involving genetic predisposition, structural brain abnormality, and neurochemical imbalance, and the network dynamics. We can say these are the main causes to cause a seizure in a humankind. So again, before I go into the nursing management, I wanted to address about the different types of seizures. So when we talk about types of seizures, we know the tonic-clonic, which is very aggressive one, which the patients can fall down and they can also injure themselves. And the next one we have the absent seizures, which is even the patients doesn't know whether that was a seizure or not. They are like it is like a daydreaming. And also we have the other kind of seizure that is called the focal seizure. And this kind of seizures only affect the one side of the brain. We have to know is we have to educate our patients regarding the causes or the substances or the things that can trigger seizures. So for this, if the patients are not sleeping well, we have to educate them the importance of the sleeps. And they have to sleep at least 7 to 8 hours if they are adults. And also, we have to suggest them not to drink alcohol, which is a greater, which can cause or which can trigger the seizure in the patients who have already other symptoms. And also, they can be taught to substitute their caffeine with other forms of drinks, like the waters or other drinks that do not trigger seizures can help them to prevent it. And also, if they are in the bright lights, we have to tell them not to go into the bright light or avoid the bright lights, or they can put on the sunglasses that can help them protect from the lights. And if they are already prescribed with the anti-epileptic drugs by the doctors, they should finish the course or they should not miss the dose. That is the prime things they have to obey. So these are the things, if they can obey or they can follow, that can reduce the risks, or that can reduce, or these are the things that can trigger the seizures, and the seizures can be avoided. Another nursing intervention about seizure is to follow during the episode of the seizure. It is called the intervention during the seizure, which is very much important, because at this time the patient can fall, patient can be injured, anything can happen to the patient. So the very great thing we have to keep in our mind is about the patient safety. So if we see a patient is having a seizure, we have to be assured that there is no any other objects that can cause injury onto the patient. We have to keep the steps away from him. We have to lower the bed at its lowest point. We have to have the rails up with padded, and there need to be, if possible, if they are throwing up or bringing up something in their mouth, make sure that the patient is on its lateral position so that he is not aspiring or taking anything into his lungs. And also we need to be assured that they are safe at this time. Talking about the patient safety, we have to keep in mind that patient cannot be restrained. They cannot be tied up or hold tight. Or also we cannot put anything into the mouth of the patients. It is very risky, that can cause more injury than helping the patient. Instead of that, our job as a nurse is to monitor and record the time. So we have to see how long does the seizure is lasting. If the seizure lasts more than 5 minutes, it is called epilepticus, and which is a medical emergency. At this time, we have to call for the rapid response team, and also we also can provide them or administer them with the medication called benzodiazepines. Another crucial nursing management is curing the patient after the seizure, so which is also called the post seizure. And the best thing at this time is to monitor them. At this time, we can see a lot of these things is happening unto our patients, like they are more confused, they are very much fatigued and tired, they also have a headache, and they also have the muscle sore, and sometimes they also can have a fracture, which can happen at any time. So at this time, the nurse main duty is to manage these things. Or if they are looked confused, we have to orient them. We have to assess them for the level of consciousness, and also they look so tired and they are fatigued. We have to provide them with some food or fluid or water, whatever they are asking for. If they are having the head, we have to manage them with the antipyretics or the painkillers, or also we can help them psychologically, comforting them, making them assure that they're very safe. And also if they have a pain, muscles or anything, we have to assist them at this time. If they have complications like the fractures at this time, we have to address them for the x-ray and also for the further treatment. We're talking about the nursing management, therapeutic, or the pharmacology treatment. Medicinal treatment is also another way to stop the seizure in the patient. There are many other lists of medications, but I got 3 here: phenytoin, valproate, levetiracetam, and there are also other more medications. But as a nursing, we focus on teaching the patient about the medications. So this medication can have a side effects like drowsiness, sleepiness, but if they have other adverse side effect in their life, always call the PCP and report about the side effect. And also, patients should be taught to take the medications completely. Unless doctor told them to stop, they should not stop the medication at any point. And also, the medication has to be taken as prescribed by the doctor and at a right time. After the nursing management, I wanted to talk to you about the community resources for the people having the seizure. So when we talk about the seizure, it is not a problem for a person who have the seizure. It is also the problem of the whole family and also the whole community. That is why we have numerous such community workers and the agencies helping those kind of people with the epilepsy and the seizure. Here I have noted two of them, which is locally available, and the name of it is a Cottage Epilepsy Clinic, Santa Barbara Cottage Hospital, which is locally available. And this hospital acts as a refuge to the person who has epilepsy and also help the family to manage the sickness or the disease that the person have it. And I also have another place that is in Los Angeles. It is Epilepsy Foundations, and this is an organization, non-profit organizations, and this also assists the person with epilepsy or seizure and also their family on the best of their income. Lastly, as a summary, seizure is a problem of a family and also the society in general. It is not only a problem of the person who have the seizure. So the seizures can also be prevented by avoiding the things that trigger seizures, and that can be managed properly even though they have the seizures by the nurses. And also we have a lot of community workers in this country to help the patient and also their family who are going through the problem of seizures and epilepsy.